But we win some, and sometimes we win big. In 1977, public health officials working around the world were able to eradicate smallpox from the face of the earth. That was the first and so far the only time in human history that a disease has been completely eradicated from the face of the earth. And public health has a very big role during natural disasters. The one that a lot of people remember, of course, is Hurricane Katrina in 2005. But even during the recent Gulf Coast hurricanes in Texas, public health people are on the scene anytime there's a disaster and there's the large movement of people who need to be evacuated. You're setting up conditions for potential epidemics, and public health people have a huge role in trying to prevent those adverse events. And we help out with people around the world. We sent teams to Indonesia when there was a tsunami, Christmas of 2004, and we had teams over in China just a couple of months before the Olympics when there was a massive earthquake in that country. And in the last 30 or 40 years, public health has played a bigger and bigger role, not just in infectious diseases, but in a wide variety of what are called chronic diseases and in preventing injuries. Public health led the effort to get people to stop smoking, and that's been a tremendous success. Not a complete success. There's still too much cigarette smoking going on in the United States. But the rate of cigarette smoking has dropped precipitously. And we can talk a little bit later about all the things that were done to bring that about. But efforts continue to work on heart disease, diabetes, lung disease, high blood pressure, birth defects, injuries due to motor vehicle accidents, injuries and illnesses due to an unsafe workplace. There's a huge spectrum of things that public health is now involved in. So in a sense, what public health is, well, by contrast, when you go to your doctor's only concern is your health, how to keep you healthy and how to make you better. Public health does for the community what your doctor does for you. We try and keep the community healthy. And that community may be a city, it may be a county, it may be a state, or it may be the whole United States. And if there's a problem affecting the health of the population, we need to diagnose it and we need to fix it. So it may be obvious why public health is important from those examples that I've given, but let me give you a few other reasons. One is historical. If you look in the Declaration of Independence or the preamble of the Constitution, it doesn't mention health. It talks about ensuring domestic tranquility. It talks about promoting the general welfare. It talks about the inalienable right to life, liberty, and the pursuit of happiness. You can't have those things without people being healthy. But it doesn't talk about health because people in the 17th and 18th century and the 19th century didn't think about their health the way we do now. We think about our health very differently because now we feel like we can control aspects of our health. Up until the middle of the 20th century, health was felt to be just another natural phenomenon, like earthquakes, hurricanes, storms, bad weather. Over the last 50 years, we feel like we've gained, all of us in the population, feel like we've gained more control over our health. And we can choose whether to be healthy or not. And we also want to make sure that the government is protecting us from other types of things that we can't protect ourselves from, whether that's anthrax or bird flu. But those are historical kinds of reasons. So let's talk about something that everybody relates to, which is money. Money's been in the news a lot lately. The United States spends about $6,100 per person a year on health. If you take all the money that was spent on health in the United States last year and you divide it by the number of people in the United States, you come up with about $6,100. That accounts for over 16% of what's called the gross domestic product. What does that mean? It means that of all the dollars spent in the United States on anything, whether it's buying a pack of chewing gum or it's a billion-dollar deal on Wall Street, you add all that together, that's the total amount of all the money spent in the United States. 16% of that is spent on health. Trillions and trillions of dollars. And if something's not done, the trend line on that is that it's going to be 20%. 20% of all the money spent on the United States in the United States goes to health. 1 out of every $5. So you would think that for that amount of money, we'd all be pretty healthy. Well, you know, the United States is a great country. I think it's the greatest country on the earth, but we are not the healthiest nation in the world. We spend all that money. We spend $6,100 a person. If you look around the world, if you look to countries that are quite well developed, you look over Europe, most of those countries spend between $1,500 and $3,000 a year for every member of their population on health. So we spend about twice as much or more on every American for health. So you'd figure we'd be twice as healthy. It's very hard to measure health. We have a lot of ways of measuring disease, but it's very, very hard to measure health. But let me give you two possible measures, two simple measures. One is life expectancy. How long, a baby born today, how long can that child expect to live? What's the average? What's the average life expectancy? Well, when we measure the average life expectancy of people born in the United States today to other countries, we rank 29th in the world. Not first. We rank 29th. We are tied with Portugal, and we come in just below Finland and Cuba. Another measure is infant mortality. And what that measures is the proportion of babies who don't survive the first year of life, the proportion of babies who die before they reach their first birthday. And, you know, kids are very, very healthy. Children and young people like yourself, teenagers, are the healthiest part of our population. But babies, before they're 1 year old, are at risk. And so one of the things that we do to measure the health of the population is measure infant mortality. Infant mortality, we come in 26th, not first, 26th. We're tied with Slovakia and Poland and come in just below Hungary. So how can it be that we're spending all this money? How can we be spending all this money and we're not as healthy as we need to be? Well, you know, I talked about the bubonic plague that swept Europe in the 14th century. And I spoke a little bit about the expectations that people have. So let's flash forward a little bit and let's go to 1918. 1918, some young soldiers at Fort Riley, Kansas, developed pneumonia. And the mortality rate, the death rate for that in those young soldiers was extraordinarily high. As I said, young people like yourself in their teens and their 20s are the healthiest part of our population. What happened? Well, that was what was called the Great Influenza Pandemic. That was the start of the Great Influenza Pandemic of 1918. That one spread around the world. In 6 months, it's estimated that 25 million people died. One of the reasons it spread was because obviously in 1918, World War I was going on in Europe. The United States entered World War I very shortly thereafter. You had huge movements of troops across the ocean by ship. It spread that disease all around the world. In the end, 50 million people died. Some historians put that figure as high as 100 million, all over the world. That, and as Caitlin mentioned in her introduction, no airplanes. Most people didn't own cars. Well, today, the risk of a worldwide epidemic is just absolutely extraordinary. And let's fast forward now and get into the 21st century. And let's talk about something that happened in 2003.